Welcome back. I will now introduce our second panel and ask that they come on up. It'll be moderated by Jennifer DeCarli, Deputy Commissioner for Family Justice Centers and Outreach at the New York City Mayor's Office to End Domestic and Gender-Based Violence. Jennifer oversees the operations of the city's 5 family justice centers, as well as the office's outreach and housing initiatives including serving as co-chair of the Domestic Violence Subcommittee of the New York City Continuum of Care. She has over 25 years of experience working with survivors of domestic and gender-based violence, holds a master's degree in social work from NYU, and a law degree from the University of Buffalo School of Law. And I've just started working with Jennifer in the last year, and I haven't seen her sleep yet. So thank you, Jennifer, for all that you're doing. Maybe tomorrow. And then we have a really impressive group of panelists today with us. These bios are so short. I encourage you all to go on their LinkedIn pages. I think we have links on our website, and really look to see all the work that they've done to improve lives. But real briefly, Kris Billhardt is the Director of Program and Practice Innovation at Safe Housing Alliance, formerly known as NASH, National Alliance for Safe Housing. Kris has 4 decades in the movement and is fueled by commitment to meaningful intersectional response to survivors. Her work on the development of survivor-driven rapid rehousing, mobile advocacy, and flexible funding has contributed to field-level change. Kris now serves as Director of Program and Practice Innovation at Safe Housing Alliance, formerly known as NASH. Welcome, Kris. Melissa Broderick, Director of Supportive Housing Services, The Road Home. Melissa oversees housing case management at The Road Home. She has been with the agency for 3 years and has worked in homeless services in Salt Lake City and Seattle, Washington for over 12 years. And she's coming in from Utah today, so we're very happy to have her. Thank you for traveling all this way. Her focus has been on housing first, harm reduction, and trauma-informed care, and it's at the heart of every decision she's made. She's focused on finding creative solutions to ending homelessness, and serving our most vulnerable community members is her passion. And Kim Maloney is part of the New Destiny family. Kim is a mother, daughter, nurse, and a survivor of domestic violence. As a nurse, she advocates for her patients, and more recently, she advocates for victims of domestic violence. Kim is another co-chair of the New York City Continuum of Care Domestic Violence Committee, which informs program evaluation, coordinated entry, and income access. And finally, we have Kristina Sellers, who is also part of the New Destiny family. She is the proud mother of 2 boys. She works as an assistant to senior vice president at the Cerebral Palsy Associates of New York State, supporting people with developmental disabilities. She is a survivor of domestic violence as well as drug addiction and has 16 years of sobriety. Kristina is an advocate who believes that experiencing bad times can help people become the best version of themselves. Welcome, everyone.
Well, good morning, everyone. It's great to be here in person. This is my first in-person event in quite some time, so kind of getting used to the in-person etiquette. I was telling folks I had to figure out what to wear today, so I don't know if anyone else struggled with that, but really, really happy to see people I've only seen in little boxes for about over 2 years. People keep telling me they thought I was taller, so I'm sorry I'm disappointing folks on that front, the fun of Zoom. But it's great to be here. I really want to thank New Destiny for hosting this inaugural symposium, such an important symposium that I hope we see many more of. I really want to thank our host, Trinity Wall Street, for funding this, for funding New Destiny, and all of you for being here and present and engaged and really committed to this critically important issue. I'm just thrilled to be here, and I'm thrilled to be here with our amazing panelists and learn from them this morning. So we don't have a ton of time. We're going to do our best because I feel like the first panel really kind of gave us that broader big picture, kind of what's the state doing, what's the city doing, what are our priorities, what do we need to change. I'm really excited to kind of dig in more with this panel on a really, really innovative approach, rapid rehousing, which we at the Family Justice Centers have been partnering with New Destiny for some time. on, and we're really thrilled to have that program through our Family Justice Centers. So I'm excited to hear more about that model that's really grounded in housing first principles, really talk about that model, what the benefits are, and then hear from survivors who have experienced that model and have gone through the program and hear what worked for them, what they would recommend changing. So again, I'm just really grateful to be here in partnership with all of you, with the survivors that are here. Thank you for being here. Thank you for making sure we're holding ourselves accountable to what we need to do on this issue. And thank you to all of the program leaders here. So with that, we're going to get started, because like I said, we got a lot to cover in a limited amount of time. So I'm going to start first with Kris and Melissa. I would love if both of you could speak a little more about the programs. Kris, the one that you started, and Melissa, the one that you're currently running. Talk about their approaches, how they approach this issue. That would be fantastic. So I'll start first with you, Kris.
Great. Good morning, everyone. Can we just stay all day? There's so much to talk about. I'm really honored to be invited to be here at this inaugural symposium, and I hope there are many more. Our story I used to run a program called Home Free in Portland, Oregon, and it was operated by Volunteers of America. It was a domestic violence response program. Shelter was its core service. And in 1998, we got our first HUD McKinney funds, and it allowed us to fund a full-time advocate and gave us $50,000, which was a huge amount, to spend on housing needs, rent. Yeah, we could even, back in those days, pay for furniture with this HUD funding, and not so anymore, I don't think. But so we didn't know what we were doing, really. Our goal was to serve, we targeted Latina survivors, most of whom were monolingual in Spanish, and some had immigration legal issues. And the goal was to serve 15 households with these funds, and to provide really intensive services for these households. And this was really the start of our moving away from a shelter-centric program and being out in the community. Our advocate was at tiendas and taquerias and laundromats, recruiting folks for this program, because they were generally survivors who didn't come through our shelter. So we were out in the community talking about this program, and then also talking to landlords and starting, to develop those services and that focus in our work. What we found was that she was able to serve basically about 25 households a year. She was very busy and very committed. And we were seeing folks get into housing with her intensive navigation and advocacy efforts, and they would still be there a year after they were no longer receiving services. And that was compared to sometimes not even being able to contact people who had left our shelter a month after they left. So we were seeing it just really achieving outcomes that we hadn't seen before, lasting stabilization, and being able to no longer have their lives defined by their domestic violence experience, bypassing shelter, and getting stabilized and returning to normalcy as soon as possible. I don't think the words rapid rehousing were even coined yet as a phrase back there in 1998. The concept of housing first had begun in the mid-90s in the homeless sector and wasn't broadly adopted yet as a strategy. But that turns out to be what we were doing. And we were really led by the survivors based on where did they want to live? What were the apartment managers that their community was being able to be successfully housed through? So learning from them where it could work for them, and also applying those flexible funds, doing the mobile advocacy and being out in the community. People often couldn't come to us. So moving away from being program-centric and going where the survivors needed us to go and where they would be safe and comfortable meeting with us. I'll say more later.
Yeah, thank you, Kris. Melissa?
Yeah. Hello, everyone. I'm excited to be here. We actually operate 3 rapid rehousing programs, but I'd like to focus on one that I'm really proud of, because we have really great resources for this program, and we're trying to model other programs after it. So this program is for families, although we we can serve singles if needed. And we have a behavioral health specialist, a clinician, APRN, a peer, and case management. And then what we're trying to bring in is employment support. And so a lot of our families, they often go through our family shelter system. However, we do have an alternative to shelter for really vulnerable families experiencing domestic violence or health issues. We take them to a motel that we're operating so they can have a little bit more privacy and stay a little more safe. Once they move in with our program, we wrap them around with all the services. We use a critical time intervention. This intervention is really awesome, actually, and it comes with phases. So at first, we're really intensive, really digging in. What does this family need? Our therapists and our APRN are going on site to where they're living to see what they need, connect them to community resources. The peer can also help with anything that's needed, rides and just someone to talk to. And then our case managers help connect to schools, and our therapist is getting in the school and helping with issues that may be popping up because of things that the children and the family are going through. And right now, this is a 5-year pilot program that we're trying, and we're trying to bring this into another program that we're just creating with our community and all our partners to be even more intensive. We are seeing that our families need at least 9 months of rentals assistance and a year of support. But then with the program we'd like to create is families can come back for another year with flexible funds with anything they need.
Great, thanks, Melissa. Before I turn to Kim and Kristina, Kris, can you elaborate a little more on what we heard about in the first panel, right? That we've really kind of started this so much as an emergency shelter movement, and really our focus was on the shelters. But we've learned, that housing needs are not unilateral, that for some folks shelter may work or shelter may be a necessity, but it's not actually what the person needs right then. So could you talk a little bit about that and kind of any resistance you faced? I mean, 1998, you were a groundbreaker. We'd love to hear that perspective and what you think.
Sure. Yeah, we really, I already mentioned that we were serving folks in our Housing First program that never came through our shelter. So we knew that there were folks with housing needs that shelter didn't really fit or shelter didn't really work for. We also opened an outreach office, and we had lots of survivors contacting us who had a temporary place to stay. The problem was not that. The problem was finding long-term stabilization and help making that happen. There also wasn't a whole lot of dialogue, and Jeff Olivet spoke to this in his remarks, between the housing provider system and the domestic violence or victim services system. And so we had to start having that dialogue, partnering with the Housing Authority and with a joint task force that was eventually developed to end homelessness. We did get a lot of pushback from our sister victim service programs, for one thing, because people were very concerned about safety, which we were as well. We also believe that you can't sequester people in a confidential location for the rest of their lives, so being out in the community is a really important thing to be striving for. Was where a lot of folks they didn't want to go to a facility or a shelter or a big house somewhere. They wanted to have their own home so that their healing could begin. And I think one of the key bases of the pushback was the concern that funding going away from shelter was going to destabilize shelter programs. And yet there's also this circle, right? So if you go to shelter and you can't find housing, you just stay in shelter longer and longer. And somebody mentioned 3 years. All the shelters were beginning to extend their stays beyond. It used to be 30 days, and it was 6 months or whatever. So if you don't have an exit plan for folks that come into shelter, then those beds are no longer available to people who really are fleeing. And you've got to start working in the housing world and shifting some of the resources from the emergency end of the continuum to the longer term services and some of the ongoing needs that survivors have was a really key part of how we talked about our change.
Thank you, Kris. Melissa, have you faced that in your community as well? Or was Kris a pioneer in 1998, so she had to face that more head on?
No, I think we still deal with this right now in Salt Lake, at least. And really what we're trying to focus on that we were talking before, I think, is prevention funds. During COVID, we were able to receive a lot of prevention funds that we did not have before, and able to keep people coming from our shelter system and still wrapping them around with all those services before they've even touched our system in any way.
Okay, thank you. So I want to turn it over to Kim and Kristina. We've heard a lot about this innovative model from Kris and Melissa, but we'd love to hear firsthand from someone who's experienced it, who's been a Housing Link client, which is the program we run through the Family Justice Centers with New Destiny. We'd love to hear from you about your experiences with the program firsthand. What aspects of the program did you find most helpful? Did we decide who's going to go first? Kim, okay. Kim?
Good morning, everyone. Just want to thank New Destiny Housing for having this event and Trinity Church for hosting. My experience started with the ADA walking me over to the FJCs. And I've never known of the FJCs before then. Well, my first experience started with standing at an elevator and seeing a paper talking about domestic violence. And I took the sheet of paper with the number and I put it in my pocket. That led to me actually calling to get help and ending up at the ADA's office. And after my meeting, she walked me over to the FJCs, and that's where my love affair with New Destiny began. And they have been a godsend ever since. And the FJCs I compare to a church because it's where you go to get help. Everyone there's there for the same thing, and it connects you with so many different kind of services. I got housing services with New Destiny. I also got financial coaching. I got a lawyer to help me with my legal issues, and that was the start of me actually starting to see that things will get better because I have this place where I can go to get this help. And New Destiny has helped. They didn't help me find placement because I went to a DV shelter, and the DV shelter didn't help me find placement. I had to do it on my own. And my aftercare with New Destiny is what mattered the most, like mental health services for myself and my son, just checking in on me. There's so many different kind of events that happen even after your place that are very traumatizing, and my housing coordinator with New Destiny has helped me immensely. She's someone that I can call whenever I need help, and my experience with Housing Link is that without the FJCs and the coordinators at the FJCs, I would have never gotten the help that I needed. Perhaps I would have been in my same situation that I was in before. And I don't think that everyone understands the effects of, even after we're placed, that the trauma that we've been through, that normal events that you guys may go through, it affects us a lot differently. And the main focus is to prevent us from going back to a horrible situation. And Housing Link is the only thing that has helped me and prevented me from going back to my traumatic situation. And I will be forever in debt to Housing Link and New Destiny and the FJCs. And my experience has been amazing. I'll hand it over to you.
Good morning, everyone. I just want to thank New Destiny for having me and allowing me to tell my story. In my situation, I was going through ACS because of the partner that I had. I was in jeopardy of possibly losing my children. It was like I was the victim, not him. So I needed to get out of where I was before becoming homeless. So that is where my caseworker for ACS actually referred me to the Family Justice Center. I think we've heard Family Justice Center a couple of times here this morning. referred me to New Destiny. That's how I found New Destiny. So the Family Justice Centers are very helpful resources for survivors, for anybody going through traumatic experiences. They will actually be the main point to refer you to resources to get help. So when I found New Destiny, it was like a lifesaver. They prevented me from having to go into a shelter. They prevented me from keeping my sobriety. You know, I've come 16 years clean. Being part of domestic violence, you know, could have led me back there, but it didn't. New Destiny was able to get me into housing safe, far away from the person that was bringing the domestic violence, you know, into my life. You know, they helped me, you know, with rent, where I was able to put a savings away. And they were always there, a phone call away, email. They constantly check in to make sure you are okay and your children are okay. Because not only was I affected, the children are affected too. We may deal with depression, mental health, being a survivor or trying to survive, but we also have to look at what our children go through, what they're experiencing, what they see. My oldest has PTSD, so we both struggle with it. So long-term services are important, not just for me, but for him. He's in long-term therapy. The past year of being in safe housing, he's come a long way, a very long way. And I think it's not only from me staying strong, but also from the help that New Destiny has provided, and for me to want to be a survivor, to stay strong and know that you can do it. So, thank you.
Thank you. No, thank you. Thank you so much, Kim and Kristina, for being here, for your courage to share your story, your strength, and your determination. We really, I feel honored to know both of you, and I'm really happy you're here with us today.
Thank you.
So we've heard a lot about the successes of these programs and why we need more of them, these innovative solutions. But I did want to turn a little bit to talk about some of the challenges that you face when implementing these programs, and perhaps challenges, Kim and Kristina, that you faced, and you alluded to a few of those. Kris, could you talk about the challenges you faced when you implemented your program and ways that you kind of dealt with those challenges? And then Melissa, I'd love to hear the same from you.
Yeah, I think for us, probably the biggest challenge is that there wasn't a blueprint. There wasn't a template or an example that we could look to. So we really did make it up as we went along. And just by finding out what worked and what survivors were telling us. So then we could look back and say, oh yes, we piloted this. We were really just going with our guts and going with our experience and that kind of thing. So fortunately, there are a whole lot more examples for folks to look to adopt this kind of model. As far as the safety concerns that we were hearing from the community and from our sister domestic violence programs, we had a safety protocol for our advocates who are going out in the community and doing home visits, or meeting survivors out at McDonald's and places like that. We also just applied the skills that we had to do safety planning. I mean, we are all about safety planning as advocates. So applying those skills and that strategy to the different situations we found ourselves in and that survivors found themselves in. So helping them feel safe in their new housing, helping them get connected to the community, and all those resources beyond just their advocate, because we didn't want to be their only reliable source of anything. As time went by, we would definitely move away from being that primary source, but always being there. The way that funding needed to shift was also a challenge, to be able to do longer term services, and we ultimately changed our whole program and moved away from shelter as the primary model that we used. We adopted mobile advocacy and flex funding in all of our programs. And so we really just kind of showed that this was working. That's one of the ways, that's probably the most important way that we met the challenges. And then the community kind of followed. So all the domestic violence programs in the Portland area started adopting, doing housing. And also responding to other needs with flex funding. Cecile mentioned it earlier today, helping people stay in housing if it can be made safe for them to be there. So doing eviction prevention and stabilization so that you don't have to go find a new housing unit. So I think the main thing we did was just show that it worked and learn how we could tweak it along the way to make it more responsive and meaningful to survivors.
Thank you, Kris.
Yeah, I think probably right now one of our biggest challenges is finding affordable housing for folks to live in. I think a lot of us can relate to that. We really want to honor choice. So we want our households, our families, our survivors to be able to pick the neighborhood they want to be in, where our funding will allow them to live. And sometimes that can be tough because where they want to live, we can't find something for them. So that's probably our biggest challenge. The next biggest challenge for folks when we get them housing is getting them stable income and working on childcare. What we're seeing is we need some flexible childcare, but folks work overnight or in the evening and there isn't childcare. Or if there is funding for childcare, it's really limited and you have to be proving that you're looking for a job or whatever. We just need some flexible funds to be able to have childcare so folks can go work if that's what they need to do. And also transportation is always an issue so that families can get where they need to go, medical appointments, school, work. So those are the biggest challenges. And then also just keeping our families engaged. We have a year-long program and sometimes that our families don't want to stay engaged, but we work really hard to keep them engaged so that we don't have them fall back into homelessness.
Thank you. Those are such important points and such important points for government and funders to really hear when we're thinking about designing programs. So Kim and Kristina, I'd love to hear from you. You spoke a little bit about this during sharing your story, but what did you find most challenging when you were searching for housing for that process, trying to find housing stability?
I think for me it was, when you move, you need a lot of funds. With moving, it's a great expense. It's very expensive, especially for someone dealing with domestic violence. If you dealt with domestic violence in where you currently were, you don't want to take that furniture with you. You don't want to take that bed with you. You want to leave all those bad memories behind and start completely fresh. So having the funds to be able to do that are very important so that when you move into your new place, you feel safe. Everything's new. So you start to recover. You start to come home and those, even though your experiences and your memories are still there, but it's easier to process them because you're not walking into a home with the couch that maybe you experienced the violence on. Or in the kitchen or those pots. So I think having the funds to move are very important. And also childcare. I have to work to be able to provide for my children. Childcare is extremely expensive. So in order for me to stay stable, to make sure I do not go back to where I was and where I can move forward and my kids to see that things are going to be okay, they need stability. They need to be able to go to school every day and be able to go to aftercare program. And in the summer, I need to continue to work and they need to go to camp and have structure in their lives. But all of that, funding is very important to ensure that us as survivors don't go back. We always want to move forward, in a new life, a fresh start, but we need help doing so. And the resources and the funds are very important because in the beginning I was scared, like how am I gonna move? How am I gonna get out of this place if I don't have the money to do so? And New Destiny Housing just reconfirmed that everything's going to be okay. You and your children will be okay. We're gonna take care of all this, which was a big thing off my back. I didn't have to think about it. They made the process so much easier and so much smoother.
Thank you, Kristina. Kim, we'd love to hear your
Thank you,
thoughts.
Christina. My biggest challenge was the repetitiveness of telling my story over and over again. So I had to tell the police, then the ADA, then the shelter system, then someone at HRA. And telling your story over and over again puts you back into the place where you were. I also think it's very important, maybe just a system where if they pull up my name, they can actually see my story, where I don't have to, say the name of my abuser and a lot of the times when we're doing these assessments, our children are right next to us. So it's kind of hard to also retell your story with your child sitting next to you. My biggest challenge was I had gainful employment, but I didn't have access to funds. So I was turned away a lot by agencies because I had gainful employment and didn't qualify for a lot of the vouchers or quick money that would help me move out of the shelter. So New Destiny and the FDHCs with the financial coaching got me to a place where I can maintain stable housing for me and my son. And I think that's very important because if there's no vision for stable housing, you feel like you're going to end up back where you left off. And it's important that we don't feel that way because we need the encouragement and the help to proceed with valuing ourselves and our safety and the safety of our children. So my biggest challenge was the repetitiveness of telling my story and not falling into the guidelines of, let's say, what a typical shelter domestic violence person is, because they have these criteria that they hold us in, and some people are going through different scenarios. Some people don't even make it to the shelter or the police. So I think that the program should be available for everyone and not into the guidelines that domestic violence victims fall under.
Thank you. Want to chime in?
Just
Yep.
to piggyback off what she said, my experience was similar. It was like all the other programs that I tried to find on my own always came down to I made too much money to get a voucher, or I made too much money to get assistance with putting food on the table. But as a survivor, and going through domestic violence, it shouldn't matter what income you have, because maybe you're using that income for your everyday expenses because you're, the one taking care of the bills and your children while dealing with the domestic violence. So it's like some of the programs I came across, I would come to a stop or a halt because I guess in the guidelines I made too much, whereas New Destiny didn't, kind of stereotype. It didn't matter what my income was. They were just there with the funds to help me get into a safe place. So I think that's also important. That was one of the challenges as well.
Thank you both. I think you've raised such important points about barriers that we might not even realize sometimes as government and programs that we're putting in front of people. And so it's so important for us to hear those. So thank you. So Kris and Melissa, I'd love for you to maybe further talk about some of the things that Kim and Kristina spoke about what's really needed for housing stability and how your programs really look to provide that.
Yeah, I think you all both just illustrated in big ways how many things can, not only before and during experiencing domestic violence, but after experiencing domestic violence, things surface, things pop up. So having a lease, having a new place is a great foundation, but that's often when things start bubbling up. The PTSD, the trauma impacts, the economic abuse impacts. Sometimes it doesn't matter what your income is because you haven't had access to those funds while you're in your abusive relationship. So there's a whole lot of stuff along the way, once you are housed, that you may finally have the space to start looking at. So not having services anymore, that's not good timing. And that's why we really advocated for long-term services availability, voluntary, of course, at the request of the person. Nothing was mandated. We moved away from that as a field a long time ago, and we need to stay away from that. But being available and being able to connect people with the resources that might help them with some of those needs. It might not all be the advocate. Again, as I said, there are resources out in the community which also helps embed somebody, as Cecile was talking about this morning, in their new neighborhood, in their new living situation. But we really found that those long-term services and the availability of those over the long haul helped deal with the fact that you cycle through different things at different times. It's not all over once you have a place of your own.
Thank you, Kris. Melissa?
She basically said it all, but we need to be able to stay with families long-term, be able to come back with flexible funding if something does happen down the road, as it always does. We always have something come up. We need to be able to speak with landlords and have people understand the landlord-tenant laws in the state or the area. We have a lot of discriminatory landlords that we need to be able to push back on and be able to talk to and create a better relationship with. We need to be able to go to the community and educate about these things. That's all I had to add.
So I'm hearing that we only have like 3 more minutes. I knew there would not be enough time, and we could speak all day about this. But I wanted to just ask, I guess, 2 final questions. The first one to Kim and Kristina. What advice do you have for mothers that may be in a situation of abuse, like you discussed and shared your story with us, and that might be facing homelessness? What advice would you want to give to them?
My advice for victims of domestic violence would be to not give up, to stay strong, and things do get better. You know, I kept hearing that over and over again, but, you know, when you're faced with all these challenges, it's hard to see the light at the end of the tunnel. So I would tell them to stay strong, and the safety of their children and themselves are more important than anything else.
Thank you, Kim. Kristina?
Strength. Sometimes we all don't know our own strength. But a woman's strength is very powerful. And so is a survivor's strength. So as long as you use that strength and know that you matter, and that things will change and things will get better with the resources out there, your children will get better. It all comes with strength, determination, and keep at it, and it will happen. There will be success and a light at the end of that road.
Thank you both so much. Kris and Melissa, I guess my final question to both of you is kind of looking at this whole issue. What advice do you have for policymakers, for funders, who are really looking at maybe funding models and programs that are so innovative like you both led? What advice do you have for them around that program funding and flexible funding and all of that?
I think they need to start using the F word, flexible. Flexibility around length of time. People can be subsidized. Some communities have standards that are really short-term for rapid rehousing. That needs to be more flexible. Flexible funds meet so many needs and fill so many gaps and help deal with some of the eligibility issues that so many survivors encounter. Think about the stimulus checks that we all got during the pandemic, right? Nobody said you have to spend it on this. There was trust in people to put that money where it needs to go, and I think we need a whole lot more flexibility around that. We started writing flex funds into every contract that we had because it was so remarkably freeing for so many survivors to have that ability to say, this is what I need to put this money towards. Building more affordable housing. New Destiny is on the vanguard of that and has been for some time. I think finally communities around the country are starting to look at that. It's an impasse that we reach when we're trying to help people through rapid rehousing models if there are no units available in the community. So we've got to build them, and we've got to move towards having more survivor-specific housing. Survivors need to be a priority population.
Thank you, Kris.
Once again, Kris has.
I should have started with you, Melissa. Sorry. Apologies.
No, exactly. We really, really need flexible funds. We need to be able to not have to seek approval here or report it in a certain way. We need to be able to access it in the moment as things are going on for families. And really, really, we need very, very deeply affordable housing. I mean, 40% AMI or lower. We really struggle, especially in a rapid rehousing program where the hope is eventually the family will take over their own rent. We have to be able to get them into a place that they can actually afford.
Thank you. So at this point, I think we're going to open it up to questions and answers. So if folks have questions, Angelina. I know you are, and I'm happy about it. There's the mic, Angelina. I love that you use your voice.
Hello, ladies. So my question, of course, is going to go to my sisters in purple. I, too, am a survivor of domestic violence and now runs my own nonprofit domestic violence organization. Statistically, we're not supposed to be here, so kudos to you two. My question is, what advice would you guys give other survivors who find themselves wanting to become advocates? Because that happens a lot. I get a bunch of DMs about it. So I would like you guys to take the floor on that question as well.
I would suggest just encouraging them to tell their stories. A lot of domestic violence survivors are ashamed to tell their stories. So I feel like the more we talk about it, the more things open up where we can advocate. New Destiny was very important in getting me to tell my story, and in articles, and I was even, given the honor of interviewing the mayor candidates for New York City and asking them very tough questions in regards to shelters and domestic violence and what their plans were for us. And I would just say to tell your story and encourage other women to tell their stories, because you never know, someone sitting right next to you may have been a victim of domestic violence, and together we could just make more changes together. So I just encourage them to tell their stories.
The same thing, encourage to spread the word, because when you speak, a lot of things can happen. You could either be helping someone going through the same situation, or you're spreading the word to get awareness out, to get more resources, immediate resources out there for yourself as well as others that are going through the same situation. So it's important to speak about it and kind of be open and not ashamed, because part of my bio is bad times, going through bad times and experiencing bad times could make you become the best version of yourself. Always believing in yourself and never putting yourself down.
I'd like to just say from a service provider perspective, your experience is invaluable to what we do, and we need it, and that's what helps us do our work, yeah.
Thank you so much for both of you, and exactly what Melissa said. Our work needs to be accountable to you, and we need to hear what worked and what didn't work. So we really appreciate you being here and sharing all your wisdom and your strengths with us. So,
Thank you.
Do other folks have questions in the audience or online?
Hi. We have many participants on Zoom that have mentioned some barriers to housing with our current rapid rehousing access to EHV and other vouchers, both within the city and outside the metro area. Some are from areas with low-income housing availability that meets the voucher requirements, and others just can't find livable housing at the rent levels in their area. So how best would you advise someone to navigate some of these issues while trying to rehouse clients, and how do we bring landlords into the conversation?
That is a really good question.
Great question to whoever posed that online. I think they might be looking to me to answer that. I can say with EHV, which I'm living and breathing every day, we are so grateful to have received city funding to work in partnership with New Destiny to address some of those issues. And I know that's city-specific resources, that's not upstate. But New Destiny's ability to have funding from the city to do housing search and support is so critical, because the issues that our survivors face are very different, perhaps, than issues someone else may face, and they really know this market and have developed relationships with landlords. So I would say it's like looking to funding to build out those specialty kind of housing search programs. But I would look to Melissa maybe to talk a little bit about some of the other questions, and then if New Destiny, if Nicole wants to add anything, please do, or Brenda. So.
As far as landlord recruitment is really tough sometimes, and so what we've been able to do is ask for flexible funds to do incentives, to do education, to be involved in meetings. We've had meetings. In fact, I was just sitting in a meeting this week with one of our property management to go over problems we have or that they're experiencing, or pay for the damages if there's damages in a unit, or just to help that landlord navigate our system while our tenants are learning to navigate being in housing.
Yeah, that's another place where flexibility can come in, to have the funds to do landlord incentives. It's a business, so even if somebody's invested in serving a population, it's still a business. So having a way that you can speak to that part of the landlord conversation is really, really helpful. I think the other thing is breaking down the silos between the homeless and housing system and the victim services system. The homeless and housing system has been there for years before we've come along as a victim services field into the housing world. And so they can really be helpful to gaining entree into some of the ways that you can work with the landlord community and that kind of thing. So developing coalition with the homeless and housing providers and the victim services providers. LA has a great model for that. For 5 years, they've had a victim services, a DV and housing services coalition that has a very strong survivor voice at the table in all things. And they've been a real political force by coming together and really raising the issues. They've got a lot of political will now that they've been able to build. So I think there's the long term and there's the immediate that we've got to be looking at both. We've got to be playing the long game as well as having those conversations and having resources to provide to landlords right now.
Thank you so much, Kris and Melissa. We have 2 minutes if anyone has a final question. One more on, oh, go ahead.
So you talked a bit, Kris, about the mobile advocacy and funding, flexible funding is working. We see it working. I'm curious, as we're asked so often about outcomes and data, if you have anywhere you could point us to show how those two are working, as you've had so much experience in that space. And then my second question is more for, I think, the whole panel. There's this two different approaches of having a place-based one-stop shop, like the FJC kind of model, where you can go and show up and get everything you need right there. And then you talked about the community-based model with the mobile advocates being out in the community. So I'm curious, to say a little bit more about how each of those approaches have worked.
Yeah, as far as evaluation, the name to know is Dr. Kris Sullivan at Michigan State University, Gender-Based Violence Consortium, Research Consortium. And they've been doing a lot of evaluation of programs that have been using a housing first approach and having flexible funds and mobile advocacy as core to that. She's got lots of information coming out and has had with Washington State programs that she's been involved with. We're also right now at the Safe Housing Alliance doing an evaluation with the City of Los Angeles, who just released a lot of funds to 8 different domestic violence programs using flexible funding. So there's definitely data being tracked, and the impact on how the immediate housing situation and the long-term housing situation is really quite remarkable. So I would point you to that.
Thank you, Kris. I think we probably have run out of time, but if anyone would like to share their thoughts on the last question. No. Okay, you might leave it to me. So I guess I just want to say in closing to the answer to your question, I believe, and I think the panelists would agree, like, we need all options on the table. We need immediate shelter for those who need to go into immediate shelter. We need innovative approaches like rapid rehousing for those where shelter isn't the best fit, right? I think for a long time we've been thinking of it as an either or, and I think, I of course, maybe a little biased because I oversee the FJCs, but the FJCs don't work for everyone, right? It might be too big and too partnered with government and too overwhelming to come through an FJC door, but that might work really well for other folks, right? And so I think we need to make sure that survivors have choices, and it's all about choice, and I think that's what we really need to honor, and I know that's what I hear when I work with Angelina through our Voices Survivor group, and I hear from Kim and Kristina. I think that's really at the heart of this, right? Is about choice and honoring people's experiences and making sure that we're accountable to what we're hearing from them. So I want to thank this panel for being here with us today, for sharing your stories so eloquently and letting us know what we need to do better. And thank you so much to Kris and Melissa, who are real leaders in this field and just have done groundbreaking work and continue to do it. And thank you to New Destiny for hosting this. And thank you to all of you for being here. Thank you.